Hello, everyone. Thank you for tuning in today's session on novel psychoactive substances found in buprenorphine samples. My name is Andrew Holt, and I'm a member of the Aegis clinical team. Aegis has provided drug testing services for over 30 years for a variety of organizations. Our testing services provide objective, clinically actionable insights to improve patient care through the identification of inappropriate substance use, whether that be intentional or unintentional. So today we'll discuss the frequency which NPS analytes were detected in buprenorphine samples. And this will serve as one snapshot of what NPS are present in the illicit supply. And hopefully this knowledge will help improve risk mitigation strategies. This data will be presented at the NatCon conference in St. Louis in April. We conducted a retrospective analysis of patient samples from individuals prescribed buprenorphine to determine the frequency of NPS detection in samples where buprenorphine was also detected. So, novel psychoactive substances are synthetic substances created to mimic scheduled or illicit drugs, but they vary widely in toxicity and potency. Of the 252,835 samples where we detected buprenorphine when it was indicated as prescribed, 803 of those samples were excluded from the analysis because they were highly suspicious of being adulterated. Of the remaining 252,032 samples, about 2% contained at least one novel psychoactive substance. And as a disclaimer, it's important to note that not all samples were uniformly tested for all NPS classes. Our testing is ordered based on medical necessity and the judgment of the clinician. So this is an underrepresentation of actual NPS use. Xylazine was the most detected analyte in the study. We detected it in over 1,650 samples. The designer opioids and benzodiazepines were almost as frequently detected in basically equal amounts. Synthetic stimulants, cannabinoids, and hallucinogen dissociatives were detected much less frequently. And miscellaneous NPS that were detected, which don't fit into any of the above classes, in addition to xylazine, phenibut, tianeptine, and medetomidine, were detected in small quantities as well. In the following slides, we'll discuss these substances in much more detail. So designer opioids are sometimes referred to as fentanyl analogs or fentalogs. However, non-fentalogs are increasingly detected in our testing. A designer opioid was detected in 1,604 samples, and 8 of the 20 designer opioid analytes detected were markers of nitazene analogs. Another disclaimer, an important consideration, plain illicitly manufactured fentanyl, sometimes referred to as IMF, is not included in this NPS testing since it is analytically identical to prescription fentanyl. This is a long list of the designer opioids detected in this study, but they're listed in the order of most to least prevalent. So some towards the bottom of the list were not detected as frequently, which could be because that drug is newly emerging in the illicit drug supply during the time of the study. Could be not as commonly observed, or something that was once common and is trending downward. About half of this list are fentanyl analogs, and the other half are predominantly nitazene analogs. So if we'd done a study like this 2 years ago, we would not have seen as many different nitazene analogs on this list because they are newly emerging in the illicit drug supply. This graphic represents the top 10 analytes detected. So while the number of unique analytes is about 50% fentanyl analogs and 50% nitazene analogs, fluorofentanyl and a metabolite or process impurity, despropionyl fentanyl, fluorofentanyl, were the most detected by a wide margin. As more nitazene analogs are introduced, it would be interesting to follow the changes in this distribution to see if they increase in frequency. Designer benzodiazepines were also detected. They are often found as counterfeit versions of prescription benzodiazepines, such as alprazolam 2 milligram bars or tablets, and liquids are also seen as well in this class. In many cases, more than one designer benzodiazepine is present in these preparations, and the labeling is not accurate. A designer benzodiazepine was detected in almost 1,600 samples. In this study, bromazolam has emerged as the most detected designer benzodiazepine over the last 12 months, with markers of clonazepam, etizolam, flualprazolam, and flubromazepam comprising the remainder of the top benzodiazepines detected. This is a comprehensive list of the analytes detected in order, again, of most to least prevalent. Again, the bottom of the list, not detected as frequently as the analytes at the top of the list. And you'll notice some of these names look very similar. Some are parent drugs and some are metabolites of those parent drugs. As we've mentioned, bromazolam is the most commonly detected benzodiazepine in this study, accounting for over 50% of all detections. It is yet to be scheduled as a controlled substance in the United States. Like many of the others in this graph that have been scheduled as controlled substances over the last year, but it would not be a surprise to see it scheduled soon, either federally by the DEA or an international scheduling action. Synthetic stimulants are distributed in various forms and are intended to mimic substances such as methamphetamine, cocaine, or ecstasy. Synthetic cathinones, also known as bath salts, are the most widely studied substance in this class. And we found at least one of these stimulants in 284 samples, with N,N-dimethylpentalone and a metabolite being the dominant analytes. But we also detected analogs of methylphenidate, methamphetamine, and piperazine stimulants as well. Again, this slide lists the stimulants detected in order of most to least prevalent. Cathinones comprise about 2/3 of this list, with the other classes mentioned making up the last 1/3, including piperazines, amphetamine analogs, and methylphenidate analogs. This is highly illustrative of how much more common N,N-dimethylpentalone and pentalone are in relation to everything else on the list. Again, this is the top 10 in this study. As mentioned previously, the cathinones remain the most frequently detected members of this class. Most of this list are cathinones. Synthetic cannabinoids, also known as K2 or spice, were originally developed for medical research purposes, but are now used recreationally. Most of these substances, like all NPS, start out as legal alternatives to controlled substances, and they become scheduled later in time. A synthetic cannabinoid was detected in 238 samples, with MDMB Panaca and ADB Butanaca accounting for the majority of these detections. This slide contains a list of the synthetic cannabinoids detected, with the top half representing the majority of the detections again. But as you can see, it's a relatively long list. This is partly because this class is one of the most active with regards to new compounds being introduced and emerging into the supply in response primarily to scheduling actions, either federally or through other countries or international scheduling actions. Again, MDMB-4 Panaca, ADB Butanaca, and 4-FMDB Butanaca were the most frequently detected. You can see they represent about 85 to 90% of the detections in this representation of the top 10 analytes introduced. Designer hallucinogens and dissociatives are intended to mimic the effects of substances like PCB, LSD, or ketamine while remaining legal. As with other MPS classes, they do typically become controlled substances at some point. However, testing orders for these substances is not as frequent as other classes, but there were a handful of detections, including analogs of PCP and ketamine, which are listed there. This slide discusses miscellaneous NPS that do not fit neatly into previous classes that we've discussed. Xylazine has been the most notable substance detected in this grouping for the last 3 years, and it was detected in 1,653 samples. Again, the most frequently detected analyte in our testing. It is known to cause central nervous system depression, and many individuals exposed to it also develop skin and soft tissue infections, which can result in amputations or systemic infections if left untreated. Tianeptine is sometimes referred to as gas station heroin because it is sold over the counter in the US. In other countries, it's a prescription drug used as an antidepressant, although that is not its primary use that we see in the US. Management of individuals exposed to tianeptine can be really complex because it has mixed action at various receptors throughout the body, one of which being opioid receptors. And that's in most cases why individuals use tianeptine. It's for this effect at opioid receptors in an effort to either replace an opioid or attempt to taper off of an opioid. It was detected in 175 samples in this study. Phenibut, another substance sold in many countries as a prescription anti-anxiety agent. We detected it in 302 samples. Similar to tianeptine, it's available as an over-the-counter supplement in the US. Medetomidine, recently been detected in the illicit supply within the last year. Like xylazine, it contributes to CNS depression without activity at opioid receptors. It's important with this one, testing for it was introduced only in October. It was a new addition to our NPS testing. So that could be one reason it was only detected in so few samples. However, it is not nearly as prevalent as xylazine is in the illicit supply at this time. It's another additive to the illicit drug supply that will be interesting to follow as time goes on. So in conclusion, this analysis showed that patients undergoing medication-assisted treatment with buprenorphine may continue substance use that could go undetected without specialized testing for NPS. Definitive results allow for transparency in clinical decision making and can improve patient outcomes. Laboratories should commit to relevant and up-to-date testing guided by established research organizations to provide meaningful results that help achieve treatment goals. Thank you for tuning in to this month's webinar, and we hope you found it informative. Be sure to look for notifications of future sessions and join us as you are able. If you have any questions, please feel free to call or email our team. We'll be happy to assist you, and I hope you all have a great day. Thank you.